Good morning, everyone. I'm sorry we're a little bit late. It's 10:02. My name is Christine Hudak, and I would like to, on behalf of the Board of Directors of Northern Ohio HIMSS, welcome you to our second virtual conference, Perspectives in Capacity Management, Extending Access to Care. I'd like to welcome our members of NOHIMSS, our guests, our CSO, colleagues from Central and Southern Ohio HIMSS, as well as our speakers and our sponsors. The board chose this topic because we realize that many of you, actually most of you, working in institutions are facing shortages in any kind of capacity, staff, supplies, beds, and that many of the hospitals are moving to remote care. So we decided that this was a perfect opportunity for us to present this topic. Now, just a few housekeeping things before we go forward. For those of you that need CP HIMSS credit, please make sure that you visit the expo, the HIMSS booth, and you can download your certificate there. If you want to join Accelerate, which is a platform, and we have a communication platform, we have a place just for Northern Ohio HIMSS. The information is there also. There's also a link to our evaluation tool, and we would like you to evaluate. Now, in between many of the sessions, we're going to have an opportunity for network and to visit the expo. So please make sure that you network with each other if you wish. Visit our expo and talk to any colleagues that you would like to talk to. And with those housekeeping details, I would like to introduce our very first speaker. Mr. Harun Rashid is the Chief Information Officer of Akron Children's Hospital and has been a presenter for us many times, and we are glad to have him again. So Harun, without further ado, I'm going to turn the floor over to you.
Thank you, Christine. Let me share my screen. Christine, are you guys able to see my presentation? Because it's not letting me.
No, I can't. I cannot see it yet.
Oh. How about now?
No. I see actually multiple screens.
I apologize. It's not letting us share. Oh, here we go. Hopefully now we can get this going. How about now?
Yep.
Is it in a presentation mode, or because I can't see it from here? Full screen? Okay. Christine, is it in a full screen? Can you see the whole thing? Hello?
Hey, Harun, it's not in a full screen. It was you were in there, or we weren't seeing presentation mode.
How about now?
Yep, we see it now.
All right.
We're good to go.
Thank you. Well, technology is wonderful when it works, painful when it doesn't. But thank you, everybody, and thanks for giving me the opportunity to speak again. When we look at the last 18 months, how pandemic has changed our life, upended it, it's been a challenging 18 months. It has turned our world upside down. world that we know it has changed rapidly and in many ways forever, in so many ways that we can't even count. Some normalcy is coming back, and you know, over time, hopefully we will have some return to the ways of pre-pandemic, but it's not going to be the same. We have to remember and recognize this as part of history, because significant implications will come about from being able to understand and learn from what's going on with this pandemic and how we move forward through this journey. If you look at people and what they're thinking about as they come back from this pandemic, people are not trying to get back to normal coming out of the pandemic. They want to know what the new normal is. You know, when will things open up? What will our life be? What will the future of patient care look like? Because some of us are in healthcare. What do we as consumers want going forward? And pandemic created a lot of obstacles for us. I'm a big football fan. I love my Tennessee Titans and my running back, Derrick Henry. And I equate a lot of pandemic of COVID-19 to his running style. He's running through the defenses. He's trying to bring it, punch a hole through it. And that's how I felt we were with our pandemic. We were trying to run through, and every time we were trying to run through something else was coming up. Something else was changing. And, we knew eventually we're going to get through, but it was one after another daunting task that forced us to address many issues in this pandemic. In order to move forward and understand the new paradigm, we need to look back as to what are the things that we struggled to do and what we worked on that became better for us as opportunities. The perfect storm in many ways. COVID-19 hit. Mask mandate. In this country, we've never had a mask mandate in recent times. And hand washing. Most of you will say that if you had a job resume and they asked you, what did you do in 2020? You probably say, wore mask and washed hands. We did social distancing, something we were not accustomed to in this country. We did temperature checking. We didn't have enough PPE to address this pandemic. Hospitals at capacity. Record deaths. You look at deaths, it was the new normal. We became immune to it. We were hearing about this over and over again, and people dying in the thousands. I'm not going to go through the whole thing, but the idea is so many things came at us, even the Delta variant. It forced to have business closures, supply chain shortages. Hospitals and businesses saw significant revenue decline. Countries are divided in whether you should take vaccines or just about the opinion about how things were going. We couldn't get to restaurants and bars. We had significant staff shortages across the board, and I'll talk about that later. Layoffs and furloughs. Overnight, we found ourselves working from home. Our normal day-to-day was no longer normal. It was different, unusual. We had to figure out what that was going to be. We wanted increased demand for bandwidth. Suddenly, we all needed more bandwidth. We identified through COVID-19 social disparities and racial inequality in this country and across the globe. Holidays were different. It was interesting. And last year in my house for Thanksgiving, just sitting there with my wife and my mother and father. I was lucky because they live with me. But usually I have more family. My sisters are there and their husbands and their kids and all. It was weird, but we survived. We became very addicted to online shopping because I know I had my share of Amazon purchases for sure. And social media. I guess if I could be in presence in the audience, I could probably say show of hands. How many people have surfed TikTok? Probably most of us. And we learned a lot from TikTok, actually. Food delivery, lack of contact with friends, and mental health. This was big. COVID, deaths, we dealt with so many things. Mental health became a huge issue in this country. And I'll talk about that a little bit. as well as we move forward into the discussion. But we are resilient. Resilience is in the part of our DNA as humans. We learned how to deal with this extreme crisis of deaths, job loss. We've done it with wars before. We've done it with bubonic plagues before, Spanish flus. And we learned to be resilient, and we learned how to handle it, just like Derrick Henry. He didn't let anything stop him. He's not going to always get a 74-yard run for a touchdown, but he kept hammering and hammering, and he gets that run. And that's how we are. We kept on working through it to become more resilient so that we can get to that end goal. But that changed everything. We had to rethink, reimagine. What was the new paradigm going to be post-COVID? How are we going to deal with things? So if you were to ask most CIOs and other business leaders, what was the top goal for 2021? We would say first and number one, keep people safe. Very important. And it's just not people, even our patients, our consumers, everyone. Enable a hybrid work environment so we can continue to work. Focus on patient experience. Very important. Why is that? Well, because we need online presence. We need to offer self-scheduling, appointment reminders, offer results so they can do that in the comfort of their home without having to come into the hospitals or and risk infection and have social distance. Improve virtual care. I'll talk about that later. Enable digital presence for workers. And this is huge and important because we started seeing unusual amount of shortage of nurses and doctors and staffing all across the business. We need to have a digital first domain that acts and complements the care that we provide. Telehealth, we'll talk about that. Remote patient monitoring, patient safety. These are all that were priorities for healthcare leaders in 2021. Work from home. Let's talk about how, so we pivoted. We created a new paradigm, work from home. Here are some fun facts of work from home. If you were one of those lucky to be working from home, no commute. That is great. It is estimated we spend an average of 9 days per year just on commuting back and forth. If you're like most people, you didn't have to worry about setting the temperature high or low in the hospital, in the office environment, because you could do that on your own now, and you don't have to fight with anybody. You definitely had better lunch options, no more cafeteria food. Guess what? You got to choose your own coffee. None of that bland coffee that we serve. Parking was never a problem. Park at your home, no issues there. Of course, you got to listen to the music you like because you were working from home. Guess what? This is a popular one. You got to wear what you like because you didn't have to worry about what you look like, below your waist, because you were able to just project your face and you could do that. I think most of us will agree you could have, another one, which is bring your pet to work every day and then do it yourself. But there were work from home pros and cons. We had staff, from an employer perspective, staff retentions improved, productivity increased, increase in staff motivation, employee availability, all of those things were important. We saw that, healthier employees. But the cons were also there equally. We saw that staff struggled with work-life family balance. Self-discipline is important. Business interruption between kids and dogs and lawnmowers and other things interrupted you. You had lack of office equipment. Isolation and loneliness created mental health issues, long work hours. If we're on virtual conferences, we forgot to eat. We just kept on 30 minutes at a time, just continuing on into the wee hours because we could work at all time. It was easy. Sense of belonging at work was missing altogether as well. So but it's working and we pivoted. Why is cybersecurity an issue for us in the future? Because You can say, how's that a transformation? Well, because cybersecurity didn't stop. When you look at, what has happened in this country, 20.8 billion healthcare dollars were used last year to just pay for ransomware. In 2020, one third of the hospitals were hacked by ransomware. 65% of them were successful in encrypting their data. 600 plus hospitals paid an average $1.3 million last year for ransomware. 18 million records exposed. And now, most recently, as you saw, a U.S. hospital in Alabama, a U.S. hospital, first linked death to ransomware. Technical things are good. We know how to resolve it. We know how to fix it. We know how to get our backups when we have a ransomware. But we need to understand the future of how do we address this? How are we going to address operational risk? For example, do we ship patients to another areas? If we are down for multiple days, do we bring transport in? What happens if our entire network is down? Are we going to be able to bring everything up quickly? And if we can't, what happens to the patients? So we have to have an operational perspective, not just the IT piece of how do we restore it, but how does the business operate? And that is the new norm, because this is good. Ransomware is going to stay with us. Cybersecurity is going to stay with us. And that is the new norm. And we have to understand the challenge, and we have to understand how to address it. And we've got to get everybody involved. It's a business decision. It is not just an IT decision. It is a business decision. If you run out of power, if you run out of water, what do? You call it a condition. And that's what has to happen going into the future with cybersecurity, because healthcare is a big target. We cannot afford to be down, and they know this. The bad actors know this, and therefore they're coming at us a lot quicker and a lot faster. And the FBI most recently have said they're going to treat ransomware as terrorism. But there's going to have to be more stick to be able to catch this and punish those people, bad actors, so that we can stop this. But the future, where we are, the paradigm, we're going to see more ransomware attacks. Data sharing and analytics. This was a challenging 18 months. Look at this stat. The US, according to the stat, was the best prepared to deal with pandemic than any other country. Yet, we've had over 600,000 deaths in this country. That's reported. The estimated total death is actually higher than that, because we don't know what we don't know, and we don't know how that has happened. And that goes across the world. Why is that? Because we don't have data. When this happened, we struggled with data. We didn't have the necessary data that's needed to be able to address the public health infrastructure, which failed us. We struggled in the pandemic to have vaccine data, therefore led to inequality in how we distributed vaccine, no centralized guidelines and all. But what COVID did is help us to address those issues. And the new norm and the new paradigm is that the FDA, the CDCs are now working together, the federal agencies. They developed a strong public health infrastructure now. And they're working together to build guidance, break down silos for data silos, and more equitable distribution of vaccine, which is great, because that's what we need. We need all of those to come together, local government, communities, and others, to be able to do that. A network of state and federal that comes together, shares data, tracks data, disease, and vaccine and other information from different communities. And we in the IT world, from a technology perspective, can help shape this, because IT needs to be able to address this. And it didn't just stop there. Not too long ago, on the innovation front, using artificial intelligence with medical imaging, doctors and caregivers have been able to detect and diagnose and understand this COVID disease a lot more. And why is that important? Because artificial intelligence embedded in our care settings will allow us to amplify this process, to analyze thousands of data points from pictures and other data points, to make much quicker decisions than humans can ever do. And that AI can synthesize that data from all of those different medical centers and find patterns for existence of new variant, or a new COVID variant or a new strain, and we can then appropriately react quickly. So in the new paradigm, we need more data and we need action of data and we need the data to be quicker so we can react quickly. Social disparity, this is a big one. We struggled to understand that we've had this much issues in this country until COVID hit. The coronavirus didn't create racial inequalities and social disparity. It just brought it to surface. They have existed in this country and around the world for a long time. If you look at the wealth distribution of a median white family, it's 10 times higher than a minority or a Black family. 70% of the Black children in middle class will not even achieve middle class in adulthood. And why is that important? I'll talk about this later. Because the economic legacy of COVID-19 has a devastating impact to minorities and Blacks and further increase racial wealth divide in this country. When you look at the vaccine inequality that prolongs the pandemic, because it prolongs the pandemic, we're not able to get to those people. 83% of the COVID that was administered, which is about 832 million vaccine doses that was administered, went to high-end and upper middle class income. Only 0.2 have gone to low-income individuals, and we've got to change that. And when you look at the pandemic's racial disparity, you can see double of, Black and African Americans, when you look at it per 1,000 deaths, are almost over double the number of most other races. When you look at the vaccination rate, once again, astounding number, percentage of vaccination per population, significantly higher than minority. If you look at, and this doesn't stop just in vaccination, food insecurity has been a challenge too, not having food. And also, if you look at from work from home, you can also see the social disparity. People that have higher education, if you look on the right side, they were able to work from home than people that did not have higher education or lower education. Because frontline workers are the greatest risk. And when you are of limited means and you have a disparity, you tend to be a frontline worker. You're putting yourself at greater risk with COVID. Addressing the racial wealth gap, it's estimated, could increase the GDP of this country by 4 to 6% in the next 4 years. And that's important. So what can be done? Now that we understand the racial disparity in this country, we can't just stay silent. We have to address this. As employers, as businesses, we need to figure out how to create incentives. We need to raise the minimum wages. And you're seeing that across the country. We need to subsidize things. We need to do more primary care, provide health care to those that need the greatest, provide access to broadband so they can connect and get educated, and teach prevention and diagnosis, monitor, give forgiveness, all of those, because we need to have it. Because if we don't, there's going to be a bigger impact to our society than we know. And the same thing around the country, around the world. When you look at the ranking of the global pandemic preparedness, 70% of the world population that lives scored below 50 on the left side of my graph. They are not prepared. So they are seeing it. And so you see that from the news. South American countries like Brazil and Colombia and all of those have had significant struggle. On the right side, look at the vaccine inequality. 8.6 billion vaccine doses that were created, 6 billion have been upper and middle income countries. We need to do a better job if we're going to reduce inequality. The good news is Trade Representative Ambassador Catherine Tai recently announced that U.S. will support a waiver for the IP rights protection for COVID-19 vaccine, engaging the World Trade Organization. This is wonderful. We should do more of that, because what does that mean? That means we are going to allow them to have the ability to make COVID vaccine far cheaper than we can, and they can distribute this quickly. And they're going to be able to do that because it is our moral right to do that, because we failed at a global scale morally and this will have profound consequences across and we're seeing that. Look at, and I'll talk about why in the next slide, because it should sadden you that we have gone through this kind of challenge. But the good news is we're learning from it, we pivoted, and we're going to do better. And so the new paradigm, we're reducing this IP restriction so that they can do this and we can get them out of this challenge that they face. Because all of those, the workforce, they're usually low wages, they don't have benefits, they don't have a good education. They all had time to reflect during this pandemic. What are they getting out of life? What are they getting out of the job? Are they robots? Are they humans? 4.3 million people quit their job last month. It's because they're fed up. They can't deal with this stress. And so when you start looking at across the country, help wanted, if we don't fix the racial equality and social disparity, these are the kind of issues we're going to have. Starbucks is going to close earlier because we don't have people. Shelves are going to be empty because we don't have trucks to deliver that. In Great Britain, there's no truckers to deliver the petrol to the gas station. Frontline service workers are not available because they're pivoted. Places like McDonald's and places like Walmart and Amazon and others are now offering higher wages, tuition reimbursement, better benefits, healthcare, childcare, and that workforce is moving on to those bigger, better things. And that's what pandemic showed us, the racial disparity and what we need to do. Because 2.7 billion workers around the world are frontline workers. We've got to treat them better. We've got to get them out of this poverty so that we can have the lifestyle we are accustomed to and bring some normalcy back. Because without them, we would not be able to do the kind of things we need to do. And you see that today, supply chain disruption. Yes, it's going to get better, but look at all the supply chain disruption by manufacturing, construction, all of that. Huge supply, 60% plus. It is estimated that this Christmas, in order to deliver all of the supplies, we need an additional 60,000 truckers. We don't have them. So what are we going to do? Well, COVID has taught us we have to think outside the box. Technology is playing a key role. We are looking at, electronic vehicle, autonomous vehicle. A couple of days ago, Hertz announced that they're going to buy 100,000 Tesla vehicles for their rental fleet. We are shifting. We're pivoting because the new norm is different. And we have to do that to address the challenges we face today. So let's look at healthcare, a new paradigm. I won't go through all of those, but we've got to focus away from healthcare to self-care. We as consumers need to take more ownership of it. We need to look at prevention instead of treatment. We need to look at personalized medicine, not one size fits all. We need to look at, instead of bricks and mortar, work at home. Instead of incentive-driven, penalty-driven. Instead of in-person visit, virtual care. All of this are important as a new shift to in our paradigm. Virtual care. We all know what has happened in virtual care. Because of COVID, virtual care leaped 10 plus years into the future. But one of my favorite cartoon, it used to be, is the Jetson. It's the little sticker, little icon you see in the middle. Jetson was introduced 1962, I believe. Look at that picture. They were doing telemedicine in 1962. Folks, we're in 2021 and we're still struggling to do telehealth. 1962, Jetson were doing telehealth. If you look on the left side, this One Medical, One Life health platform that just went live a year plus ago, their model is amazing. You can go to a primary care. We can same-day seeing telehealth 24/7, and they have already 100 plus location. On the right-hand side, one of my favorite in China, 1-minute clinic. You go into the booth, you see a physician, you can get a second opinion, you can get a lab referral, you can get a referral. And oh, by the way, when you come out of it after the telehealth visit, there's a medical dispensing unit. It dispenses your medicine. How cool is that? When you look at the left bottom, India started teledentistry. On the right, virtual reality for teleeducation. But the biggest issue in this country, because of everything that happened, is mental health. 1 in 5 suffered from mental health. 33% experienced stress, anxiety, sadness, coping with death. My sister-in-law, who was a critical care nurse, cath lab nurse, died in 10 days after contracting COVID, and she was in healthcare. 6 in 10 are now using telehealth to address mental health. And that's amazing because we thought everybody had to come into the building. In the interest of time, I'm going to fly through this a little quicker. Around the world, it is estimated by 2025, we're going to have 75 billion IoT devices. Anyway, all of those smart devices, smart fingers, smart bracelets. And as I tell in all my meetings, if anybody buys a smart pen, please let me know what that's used for, because I'd love to know. So digital health, we have evolved. We need to take more control over our lives. And COVID taught that because it's important. So when you look at all these devices that are in the market now, amazing stuff is coming. This is already here. This is not sci-fi. It's going to ramp up and go faster. Using your iWatch, you can now do pulse ox, sleep tracker, ECG. On the right side, I have one of those beds. It tells me how I slept. If you look at the smart textile in the middle, Hexoskin, it's monitoring heart rate. Athletes use many of those things, but it's giving us ideas of how to lead better health. The one with the iPhone in the middle, that's your COVID test. You'll be able to do your COVID test and use your iPhone very rapidly and get results. How cool is that? But we as consumers now have to take better care of ourselves. And by doing that, if you look at on bottom left, that says, listen to your gut, that's your microbiome. People are now using this to identify key role in the development of the immune system and protection against pathogen, $100 to $300 a kit. Colorectal surgery, second leading cause of death in the country. 60% can be avoided by appropriate screening. Fine. And so using this Cologuard, you can do tests at home. It's not 100% there yet. Studies show that they still miss things, 30% of it. But it's a step in the right direction. Autonomous vehicle and self-driving cars didn't happen overnight. And the same thing is going to happen in medicine. It's going to take time to evolve. But these are positive signs of transformation and new paradigm in healthcare. The final, last one on the side, key to early diagnosis and setup, prevention. You could take this genome sequencing test, go to your primary care, meet with them, understand the clinical impact to your life, and come up with a plan, and thereby avoiding something serious in the future. And for those of you that are animal lovers, hey, guess what? There's a whole genome sequencing for your cats as well. I believe it's anywhere from $49 to $130 if you want to do that. But there you go. It is not just for humans, it's there. And this is important for us to move forward with because digital giants are everywhere. The Microsoft, the Googles, and the Amazons, they're getting into our business and they're changing our business and they're going to transform our business because they saw how inefficient we are and they're bringing in all this technology in the peripheral to make our lives better. Let's talk about patient throughput and capacity management and why this is so important. I think this is another one we have to pay attention, and this is a shift again in paradigm. Patient throughput and capacity really addresses care coordination. It addresses the staffing shortages we're facing, bed capacity, discharge delays, and other issues that reduces the patient experience. But it cannot be fixed by a single vendor platform. We need systems to share data to work and achieve that success. We need more sophistication, interoperability with artificial intelligence and data sharing that allows us to be able to address the operational bottlenecks, understand where there's capacity issues. In an era when we're trying to do cost and cost containment, operational efficiencies, facility resource, we need to come together and understand how cohesive technology strategy and resources can address some of these challenges, because this is the new norm. And this is we have to change to be able to address this. And we're already doing that. Many of us are doing it, but we have to do more, because these are all very disparate systems right now in many cases. And in the center of this is nursing. We need them to be involved across admissions, bed management, patient flow, so we know what beds we have, but just not within our health system. What if we had a pandemic like that and we knew that we could transfer it to another place because we knew the capacity of each other and we understood what supplies we had? Go away from hoarding supplies instead of on demand in the supplies as well, and track patient movement, not just inside the hospital, but outside the hospital, to make lives better. So finally, we need to be a connected community globally. If we're not connected community, we're going to struggle in all those things we talked about, the supply chain, the racial inequality, the frontline workers. And what we've realized coming out of this is that this is important. We have to change. So what were the lessons learned? Finishing up here, we know how to be resilient. We faced tremendous difficulty, but we rose above it. Masking helped fight the virus. Many of you said, hey, last year we didn't have as much flu. Well, because we were using masks. We need to believe in the science, and we need to understand that that is here to help us and make us better. COVID brought forward telehealth adoption 10 plus years. I talked about that. Everyone is not treated. And I think one of the important in telehealth that is important is technology is rapidly outpacing regulations. We have to change. We have to work together to fix that. We need to have better payment models. Interstate telehealth is going to create new norms for us where patients can be seen across the borders, which is all exciting because we're going to provide care to underserved areas. But we need new payment models and we need to move forward with the regulations. And I think the genie's out of the bottle. It's not going to stop. 98% of the people that have telehealth has a favorable experience. 70% would prefer online experience versus in-person experience. And telehealth, we cannot just say telehealth can only be used in a crisis. We've proven it works now. And we knew it works. It's been done way in the 2000s. But patients love it. Genie's out of the bottle. We need to do more of this. But that's the lessons learned. And our industry has shifted. We learned everyone is not treated equally in a crisis. We have to address the social disparity. And the new paradigm is going to continue to work on that. Vaccines are working. I'm going to stay away from the political aspect of it. Vaccines are not magic bullet. We got lucky. We were very, very lucky that we were able to get the vaccine out that rapidly. But if you remember, there was a previous SARS virus that happened a couple of years back. Our scientists were already looking to figure out how to create a vaccine for that. So we were lucky that we had some prior knowledge, not only with the SARS, but other viruses, and we were able to bring that forward to create a vaccine so quickly. But we still haven't done everything. We still don't have a vaccine for HIV. We still don't have a vaccine for cancer. So we still have a lot of work to do, but vaccines are not for everything. Mental health issues need greater attention. This is trying times. We're coming out of it, but we saw how this impacts us in a community. Deaths, not being able to see the loved ones, very important. We have to pay more attention to this. We learned from this that the human connection is very important, and technology played a great role in keeping it going. Imagine if we didn't have the ability to video conference, make phone calls, text, how life would have been. We need that human contact. That is in our DNA, and we have to continue that. I think this is a good one. Humility keeps us sharp. What COVID-19 showed us is that viruses are more powerful than we are. We are learning as we go. Our scientists are learning as we go. They're doing their best. But I think it's a dose of humility that there are bigger things at play, and we have to learn how to address those. And finally, we've got to think globally, not locally. Because if we don't think globally, when we were in the midst of this, what happened? We didn't have PPE. Well, guess what? Where was the PPE being made? In China. Well, guess what? That couldn't be shipped. We have to work together if we're going to improve this. And that is the new paradigm, is thinking outside, reducing barriers, and allowing people to work together. So finally, I think what I can say is that we experienced all this pandemic before. This too shall pass. Let's stay connected. And the new normal in the future, the new paradigm, is going to be far more technically driven with good challenges, but with an optimistic future that creates new opportunities for us. Thank you very much.
Harun, thank you very much for your presentation. I think you've given us all a lot of things to think about. Very much enjoyed it. I do not see any questions in the chat, so I think I will move on to our next speaker. It gives me great pleasure to introduce one of our board members, Mr. Larry Voighton. Larry has been a longtime board member, a longtime friend. He is our chair for advocacy for the chapter, and I know he won't blow his own horn, so I will. He was recently given an award from National Hymns for being the Advocate of the Year. And that says a lot about what Larry does for the chapter and what he does for all of us. He's going to give us an update on chapter advocacy. Larry, it is now yours.
Thanks, Chris. I'm going to share my screen here in a second. And hopefully you can see my slides. Is that true or not? Chris?